Homelessness continues to be a major problem in many Canadian cities, and while our approach hasn't changed much over the years, the same can't be said for other parts of the world. From building homes in people's backyards to extending city services to homeless encampments, all kinds of new strategies are being tested as part of an effort to create housing. But are these approaches effective or just gimmicky? Joining us to talk about the strategies is Dr. Hwang. He's the director of the Centre for Urban Health Solutions at St. Michael's Hospital in Toronto. Good morning to you.
Hi, good morning.
Let's give people, first of all, an idea of what kinds of numbers we're talking about when we talk about homelessness here in Canada. Right now, about 35,000 Canadians are homeless on any given night. It's across the country. And a large proportion of those are either heading towards shelters or they're youth. 18.7% of them are youth.
Yeah, it's really shocking statistics and really concerning for every Canadian.
All right, well, let's get right down to some of the solutions. First of all, how do we as Canadians overall respond to the problem of homelessness?
So we have had a patchwork response up until now, and I think that we're moving towards more systematic solutions to really end homelessness and get to the root causes, and that's really important.
All right, let's take a look at some of this research that you've done around the world, starting with Portland, Oregon. They have this plan. Now, this raised a lot of conversation around our newsroom table about building mini homes, so building space for people in other people's backyards. This is a sample of what the houses would look like?
Yes, so these micro homes are really all the rage. A lot of people are talking about them. I think that they are a possible solution to homelessness in situations where you can find land and appropriate places to put them. I think that we should remember that we do really need to create affordable housing, but the good old-fashioned way to do that is to build affordable apartment buildings, and we haven't been doing that in Canada for the last 25 years.
All right, so another solution that's taking place in Hawaii right now, officials reviewing a bill that would classify chronic homelessness as a medical condition. What's your response to that? Would it work?
So it might. I have a bit of a complex answer to that. We know as physicians that people who are homeless cannot get healthy. People need housing in order to recover from their illnesses. Mm-hmm. So it's necessary, but it's not sufficient. The key thing here is that it's very expensive to provide housing as a prescription, and so we probably need to select individuals who are in the greatest need for housing as a solution to their medical problems.
All right, in Oakland, officials there, this is their option. They're going to extend city services to a designated homeless encampment. When they tried this, what happened?
So providing services to homeless encampments is far better than the approach of going in with the police and trying to tear down the encampment and just move people along.
And when we talk about services, what exactly did they extend?
Well, they were providing things like sanitation, health services, trash pickup, those kinds of basic services. I think that what we have to realize, though, is that we don't want to be creating services for encampments. What we want to do is be preventing homelessness and preventing the creation of encampments. And that's something that we've so far seen relatively little of in Canadian cities.
All right, well, speaking of Canadian cities, there is an example out in Medicine Hat, Alberta. They've taken what's called a housing first strategy. And in fact, they've claimed to have eliminated homelessness there. This is exciting. Talk to us about this.
So housing first is the idea that for someone who's chronically homeless, rather than saying first we're going to have you stop using substances and get treatment for your illnesses, and then we'll give you housing. The idea is that first, immediately people receive housing and support services. And this is a very effective approach for ending homelessness rapidly.
So did they build an apartment block, like what you're talking about?
No, they didn't. What they did is they actually used what are called rent supplements or rent subsidies to use existing apartment buildings to move people right off the street and from shelters right into housing.
And this has been successful for them?
It's been extremely successful, and it is possible to end chronic homelessness with this approach.
And when they built these communities, did they build it, somewhere separate from the city? Did they build it right downtown? Where did they go? Because we run into this issue of NIMBY, right? Not in my backyard?
Right. So the beauty of housing first is that you house people in apartment buildings that are in the community. And so when someone moves in, they're just like anyone else in the building and in the community. And it promotes the social and community integration that we all need. You
are the expert, so we're going to give you the last word. What do you think Canada needs to do to work towards a solution for homelessness?
Well, we really do need to create an affordable housing strategy, because We're just not creating housing in our cities for people of modest income. And we also need to be preventing homelessness in youth and young adults.
Dr. Hwang, good to have you here this morning.
Thank you.
Thanks for your insights.